I was already saying that tinnitus has to be treated earlier. So when a tinnitus is not properly treated, the cochlear pressure will be increasing. What happens that pressure, by that pressure, the endolimb and perilimb liquid inside the cochlear get mixed up together at different parts of cochlea, by which a patient can able to see that in an audiogram. The patient is hearing from 250 hertz, which is supposed to be the most highest level of a person hearing capacity. It is lying on the 80 decibel or whatever the decibel, 80 decibel he is hearing. And when the distance increases, for example, the patient is hearing at 4000 hertz at 20 decibel. See, if I am keeping here papa, it has to move. By keeping here papa, it should not move. But in a Meniere's condition, if I am keeping here papa, it is not moving. But here papa, it is moving. Which means the long distance sound he can able to perceive much better, and the short distance sounds, sound from very near, is going to hear lesser. The pattern in the Meniere's condition usually varies. Okay, a Meniere's disease is a condition where the audiogram tends to get more variation depending upon the exposure of the causative factor. In case the causative factor is less, the condition will improve. In case the causative factor will be higher, the condition is going to get worse. So what happens in a Meniere's disease, the endolimb and perilimb get mixed together, and the patient will be having a vertigo in case for certain movements actually. For example, the rise of head from high and down, from sideways or in this way. The patient is going to have the vertigo attack. So what happens, because of the semicircular area of the cochlea, the liquid inside those areas has been reduced because of the lesion in the cochlea. A patient is going to have that tinnitus and same way the vertigo. Okay, this is the thing. Don't increase the pressure to the cochlea so that you can able to prevent the hearing loss or tinnitus from getting worse. By preventing those things, you can able to increase the hearing capacity. Don't use any hearing aids, and we are not advising any patient to go in a giant wheel, any circular motions that was going to reduce the hearing condition altogether, particularly a weightlifting or a forceful defecation that is going to increase the condition of Meniere's disease by increasing the cochlear pressure. In this way, you can able to protect your hearing condition, because prevention is always better than cure.